normal, right?
So Doug, I love your articles in Forbes, and the one that you wrote on the Martin Luther King Jr. holiday, I want to quote to you,
Oh,
quote something back to you. You said, born in 1929, King's existence as a Black man was always contingent and conditional. I grew up in the Martin Luther King era, and I know how much he was hated. In insisting and how J. Edgar Hoover tortured him
yeah.
by revelations of his infidelities and
Hmm. Hmm.
other ways of trying to bring him down.
Hmm.
I start quoting again.
Okay.
In insisting that America live up to its promise, Black men and women had no choice but to sacrifice their bodies and lives. So here we are with the confluence of a battle with racism, ongoing battle with racism,
Mhm.
and an ongoing pandemic, which disproportionately affects African Americans. The sacrificing of bodies and lives seems like it still rings true.
You know, I believe it does. I mean, I think at the beginning of the pandemic's effects, I wrote a campus message with the title, "Are we really in this together?"
Hmm.
Because that "Are we in this? We are in this together" was the slogan early on that was really about bringing people together to fight this pandemic. But it became quite evident, whether you're looking at the disparate impacts in terms of exposure, infection, hospitalization, mortality, uh, to the murder of unarmed Black men in police custody, right? And it, to, it persists in part because the country, and particularly the federal government, has never undertaken an accounting of the harm of slavery
Hmm.
and racism.
Hmm.
And what that means is that understanding the harm of slavery and racism is really a choice for people. For most people, you choose to learn about it, and if you choose to learn about it, do something about it, right? Whereas if you're Black, you're constantly forced to reconcile these contradictions of living in the freest country in the world, the wealthiest country in the world, and yet your basic condition of existence is subject to a question mark, right?
And on top of that, I'm thinking about vaccinations now, COVID vaccinations, and there's a lot of talk about Black people being in general in this country being hesitant to take the vaccination, and I don't know if a lot of people, experts, are taking into consideration the history, the mistrust,
Mhm.
the that is fueling this hesitancy and has fueled it for decades. And
Yeah, and I think, Kimmy, you make a really important point, because there's a long-standing community of people in the United States who are not just skeptical, but opposed to vaccination in general. And often these are white, affluent, educated people who just object to the idea of being forced to have their child being subjected to vaccination to prevent mumps, let's say, right? So that's one population. But when you look at the African American population, that's not the reason. One reason, as you mentioned, is just this history that we know that's a product of intergenerational trauma that's transferred from generation to generation. I knew about um, the Tuskegee experiment because my parents told me about it. Right? And then another thing to consider, and this became quite evident during the ferocious debate over the Affordable Health Care Act, is that the structure of healthcare in the United States excludes far too many Black people from even accessing health on a regular basis to habituate themselves to preventative practices to lengthen their lives, because you either have to have it associated with your job. In some states, they essentially dismantled the Affordable Health Care Act for no other reason, but it was led by Barack Obama.
Right.
Right. And then that's just the structure. And then you actually have the experience of being subject to a wide range of forms of discrimination. I mean, we piloted this program around bridging the transgender community and the medical community, in part because, you know, the encounters that transgender people have with health professionals is particularly troubling.
Yeah.
Right. So there's so many different ways in which, if you are a Black person, if you are a Black person who's transgender, if you're a Black person and you're gay, if you're a Black person and you're poor, if you're a Black person, if you're middle class, if you are a Black woman, a Black man, a Black child, there's not only hurdles but barriers, and even if you get back behind them, you may experience an adverse encounter, right? And all these things accumulate, and no one ever talks about dentistry.
Right.
Right.
Yeah.
So in some sense, there's a lot to the thinking and behavior of Black people in relationship to the vaccine. And one final point, let's not forget that the development of the vaccine was undertaken by the prior administration, which was one of the most vigorously racist federal administrations, certainly of the 21st century. But I would put it in the league of 20th century administrations before the Kennedy administration.
Oh yeah.
Who can we believe?
I want to go out again and talk about COVID.
Okay.
And talk about both two points I want to ask you about. One is, I've not seen any data that shows vaccine distribution by race, zip code, other indicators. I haven't seen that yet. Number two, yesterday I got 2 text messages. You know, my work is in Southern Africa. And 2 longstanding colleagues in Zimbabwe died.
Wow.
From COVID on the same day.
So sorry.
We do work in Malawi, and I was talking to my partners there, and they're having an explosion of COVID, and all they can do is offer oxygen. They have no other treatments, even at the best hospitals.
Wow.
So we have this situation that we now have two effective vaccines, very effective vaccines. We have some others that are less effective coming online that appear not to be as effective against the South African variant. What are the African countries going to get?
Yeah. Like COVID not only exposed the pre-existing inequities in the United States, it's also exposed them in the global community.
Yeah.
I think in some sense, Operation Warp Speed, and this is true for other countries, particularly in Western Europe as well, they prioritize members of their own society, right? Bought up a lot of the existing supply. And I doubt if there were many countries, certainly in sub-Saharan Africa, and I would say elsewhere in the developing world, that had the financial capacity to sort of prioritize their own countries. I think the head of the WHO made this point and saying, look, you know, if we can't share, COVID is going to still pose a threat to the entire globe.
it's in a very real way. We're re-fighting the issues, the battles that we had with HIV when
Wow.
we discovered these life-saving medications, very expensive drugs, and it was actually in the year 2000 at the Durban International AIDS Conference that the world stood up and said it's not okay that you can have them in rich countries, but we can't have them in Africa where the bulk of the cases are. And that made a real difference.
Yeah. Yeah.
We need a similar movement for COVID because this disparity is highly, highly, highly immoral.
I think it is, and it also demonstrates how easy it is for people in relatively privileged countries to tolerate it,
Yeah.
to sort of to on the one hand see themselves as part of a very moral society, but tolerate this, ghastly act of indifference. And I think that this is a type of reckoning, and I know that word is used very often, but it truly is. In some sense, we're actually seeing suffering before our very eyes, and many people want to avert their eyes. And I can only hope, and I like to believe that in the University of California, and particularly the Global Health Institute, that's a platform for drawing attention, but also mobilizing people to really address these disparities, right? Yeah. Because you're going to pay for it one way or the other.
Yeah, absolutely.
We're really good at being very financially dumb in the United States. We would rather lock people up. We're really good at that. A third of the prison population in California are Black, but you're also creating an ideal context for the spread of COVID.
Yep.
Right?